A man fell face first onto an 18-inch drill bit after his ladder broke.
Awful. Mysterious knife placements, the unexpected dangers of candy, and the cautionary tale of tree trimming. Today, we're back breaking down and reacting to all the jaw-dropping medical scenes and wild injuries from the highly successful animator Zack D Films. Thank you so much to IP Vanish for sponsoring today's video. Let's dive right in.
He noticed his nipple leaking out of nowhere, so he went to get an x-ray, which revealed a knife in his chest that he didn't know about.
What? At first I was like, oh, galactorrhea, you were having nipple discharge in a male, you were very concerned about like cancers or hormonal abnormalities. But no, it is a abscess in the tissue that is then eventually forcing its way out, just like any foreign body would in our body.
Years prior, he was stabbed in the back during a fight, and the knife had slipped through his shoulder bone, falling into his chest cavity without him ever knowing.
Stabbed in the back, broke through the scapula, broke through ribs, went through lung tissue, not causing issues relating to breathing, no pneumothorax, no hemothorax, no chylothorax, no infected lung tissue. Really interesting.
His skin closed over it and sealed it in. But over the next 8 years, it slowly got infected, eventually forcing the pus out of his nipple. Doctors performed surgery to remove it, and the man survived for the second time.
What? That is crazy. That is a crazy story. Because it was a knife, it actually will reflect or block the beams, so it actually will show up on the images. But there are materials out there that actually don't show up on x-rays.
The gum exploded inside his mouth the moment he started chewing.
If you have a massive amount of facial trauma, it doesn't necessarily mean you're going to die. What's going to kill you is the airway, bleeding out, and if the explosion did anything related to the brain. You can blow off your jaw, rip out your tongue, but still be alive.
Before chewing gum, he liked to dip it in citric acid.
Oh no.
He accidentally grabbed the wrong jar. Instead of citric acid, he coated his gum in an explosive chemical.
All right, quick timeout from the chaos. Real talk, I'm not judging, but we've all searched something questionable at 1 a.m. The problem is your internet provider sees it, public Wi-Fi sees it, and incognito mode only hides it from people in your house. I do a lot of private medical charting at home, and that stuff has to stay locked down. So it only makes sense to treat your online life with the same kind of protection. That's why I use IP Vanish. It puts your entire connection inside an encrypted tunnel so nobody can trace what you're searching for or where you're searching from. It also protects unlimited devices, which is great because most of us bounce between our laptop, our phone, and gaming console nonstop. Listen, it's not just your average everyday VPN. It comes equipped with cloud storage that works like a digital safe for your important files. Right now, they're offering an over 77% discount, totally risk-free with a 30-day money-back guarantee. Just hit the link in the description below or scan the QR code. And when you support my sponsors, it helps me keep bringing you guys more Zack D Films reaction videos like these. All right, back to the chaos.
And it instantly destroyed his jaw and lower face. His family heard the blast and ran to his room, but he was already dead.
If the individual has a pulse, what do? You can't use the bag valve mask. There's no place to put it. Sometimes EMS is able to put the tube into the trachea and protect the airway. If the person is still breathing on their own, you're trying to prevent blood from getting in their airway, supplement the oxygen as you can, and get them to the hospital ASAP.
As she yawned, the round end of her jawbone slid out of its socket, and the muscles around it pulled tight, but couldn't push the bone back in place, leaving her jaw stuck wide open.
Awful. This does happen occasionally. That does come to the emergency department, a jaw dislocation. Some people are more apt at getting it than others. Usually happens when you're opening your mouth really, really wide for whatever reason, and usually it slips forward.
Doctors took x-rays and saw the joint was dislocated. She waited for hours, jaw still hanging open, until they finally sedated her.
When it comes to sedation, sedation. We're using medications that last just a couple minutes to have you fall asleep. You do not need a breathing tube for this. This is a procedure that is pretty much bread and butter of emergency medicine.
4 doctors pushed and pulled until the bone finally popped back into its socket.
As an ER doctor, we are trained to put these back in. Having somebody sit up, put your thumbs in their mouth with gloves on, and sometimes either popsicle sticks around your own fingers or gauze. That way somebody doesn't bite into your own fingers. Downward traction and a little bit of pull forward and back.
He fought for his life until someone finally noticed and pulled him out.
Oh my gosh.
He'd been cut off. His coworkers tied ropes around his stumps to stop the bleeding.
The workers did a great job, right? So they used whatever they could to reduce blood loss. Rope is fine, but you need something to tie the tourniquet. Maybe you stick some sort of hard, unbreakable piece of metal or something like that to help spin it even more. It's going to cause pain, but you're trying to prevent somebody from dying at this point.
His heart stopped on the way to the hospital, and he needed 15 pints of blood. But somehow he survived and still lives an active life without his legs.
We are made up of about 10 to 12 pints of blood. Usually if you lose 40 to 50% of your blood volume in one moment, you're going to pass away. You go through different stages of hypovolemic shock relating to tachycardia, hypotensive, decreased organ perfusion, no urinary output.
He was way too short to join the army, but a tumor was developing in his brain.
Short individual that then developed what's most likely a pituitary tumor. Pituitary has to do with a lot of hormonal regulation in our body, one specifically growth hormone.
It triggered his hormones, and suddenly the 4'6" man started to grow.
Growth hormone starts significantly increasing. We're gonna start seeing massive amounts of growth to an individual where you wouldn't expect it. Something more commonly that we've heard of, something called acromegaly, which is the basically inappropriate secretion or increased secretion of growth hormone. You think of people like Andre the Giant.
His hands, feet, and tongue expanded, and he grew over 2 feet in just a few years.
Wow. You can still have pituitary tumors that don't actually then cause any significant abnormalities. You can have inappropriate secretions causing Cushing's, or you can have something called a prolactinoma, which is inappropriate production of prolactin. In the ER, when we do CT scans, sometimes we see pituitary tumors, but then patients are asymptomatic and just need to be monitored.
His spine curved. Soon his vision blurred, and eventually he had trouble hearing.
Complex reasons why somebody would lose hearing with this. One, the tissue could be growing just like everything else is growing, or there's issues relating to the nerve. Same with the vision loss. Because the tumor is growing, it could push on the optic nerve.
Finally, doctors removed the tumor, which slowed his growth, but it didn't stop it completely.
They did a transsphenoid removal, basically going through your sphenoid sinus to get to the brain.
By the time he died, he was 7'8", making him the only man to live as both a dwarf and a giant.
Wow. Pretty amazing. And yes, people who ended up having this type of inappropriate secretion of growth hormone don't live to the normal expected lifespan for somebody their age and sex.
He built the Lego bricks around his arm stump when he was just 9 years old.
Looks like this individual has transverse limb deficiency, basically where it stops developing around the elbow, could be above, could be below.
Hoping to create a prosthetic arm.
He still had function of the joint at the elbow potentially here, so you could bend, and there appears to be some remnants of like fingers. They could be used to mechanically move things.
In the womb, his right arm never fully developed.
This individual was born without a complete or fully developed extremity, which does happen. Most of the time now you're doing anatomy scans when somebody is still in utero, so you might find this out before the baby is delivered.
He made his first Lego arm. Now, that first version didn't work, but he tried again years later, making an arm with a movable elbow and a grabber to pick things up.
See here, you have multiple joints, you have opening and closing of the distal grasping mechanism, and that's controlled by the arm, controlled by your brain. But if it was just higher up and a kind of a stump at that point, then it would be a lot more difficult.
He was working on a shoe when his thumb got caught in the trimming machine.
Yep.
And in a split second, the blade had sliced through his thumb, dropping it to the ground.
Oh no, you gotta be really careful. I've had patients come in where they lose digits because of a very similar event. Control the bleeding as best you can. Find the thumb, bring it with you. If you have time, put it in a cold water bath, maybe with some ice, but not directly on it, wrapped in something to protect it, and get to the hospital.
He was rushed to the hospital where surgeons amputated his big toe. Next, they connected the blood vessels, nerves, and tendons where his thumb used to be.
Okay. He's told us on that side, it's great toe. It's going to inhibit movements, pushing off, good balance, those sorts of things. But would you rather have the ability to use your hand appropriately, especially maybe if it's your dominant hand, versus, continue to be a sprinting athlete?
After months of physical therapy, he could use his toe just like a regular thumb, allowing him to use his hand and get back to fixing shoes.
Because it's your own, you're not going to have a rejection of it. You just need to make sure that you attach the blood vessels well, the nerves and the tendons. There's something called a replantation team, to where there are specialists that will actually replant limbs back on the body, and they're specifically trained for this.
A man fell face first onto an 18-inch drill bit after his ladder broke.
Awful.
That's awful.
You guys always know what I'm going to say when you have an impaled object. Don't pull it out. Even if you couldn't, don't attempt to pull it out, because you don't know what structures it's hitting or not hitting. You might freak out. Remember, just count to 5 before you do anything, and just pause for a moment, get your bearings, then assess the situation. Just stabilize it and get to the hospital.
The bit penetrated through his right eye socket and exited behind his right ear. In shock, he felt the bit lodged in his skull and was rushed to the hospital.
Gotta reverse it. Reverse! Reverse! So it didn't hit the temporal lobe of your brain. Bone destruction, soft tissue destruction. If it's that close to the brain, really, really concerned about getting an infection.
When doctors went to remove it, they found that it had somehow managed to push his brain to the side instead of impaling it. It was carefully removed and he fully recovered.
Fully recovered? Are we saying that he did well to where it missed his eye and his eye is still intact? If it went right into the eye socket through the eye, you're not going to recover the eyeball. The eyeball will be gone. Zack D Films did it again. Really cool videos, and these are really awesome relating to medicine and experiences that people have had. So if you guys enjoyed this and you want to see more, please let me know, and definitely binge watch this playlist right here. As always, do me a huge favor, continue to grow this channel. Please subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.